particular lung, upper end, lower end, and anterior end and posterior end. Next, we go for identifying this particular lung belongs to which side, right side and left side. The key for identifying this particular lung belongs to right side or the left side is not by the lobe. Rather, we have to find out a notch which is present in particular lung. So, if you look by this particular lung, by this anterior border, the anterior border of the anterior lung and anterior border of the right lung and anterior border of the left lung is different. Notch or deficiency. That particular notch is constant for the left lung. We call this notch as cardiac notch. That particular deficiency is only present on the left lung. So, this left lung and right lung can be identified based on this anterior border having a notch or not. Then, identifying the notch, you just like double check it with these lobes of the lung. Right lung should have three lobes, left lung should have 2 lobes. But having said that, is a human specimen or a biological specimen, not always 2 and 2 is a 4. It could be something between 3 and 5. So, we have to accept that it might have some kind of variations. So, the right lung may have 2 lobes instead of 3. Maybe not have that particular fissures which is not be cutting this particular lungs prominently, right. So, it might have that, and the left one having 2, easy to identify it, but that is not always universally true. It might have variations. So, what thing is that we are going to identify in a reverse way is that we identify this particular anterior border first. One for this anterior border is continuous or not, or it has a notch or not. If this particular anterior border have no notch and this particular lung belongs to have 3 lobes, we go by this particular lung as right side lung. If you have a notch present on, so this hallmark of identifying it is that whether you understand this particular on the specimen or not. Sometimes it happens during examination, we are very nervous. It happens, right? So, during that nervous moments, you may not feel this particular thing which you are saying right or wrong. So, thing is that the theoretical word utterance helps us to identify whether you have gone through or not. Sometimes it happens that you understand that but cannot demonstrate it properly, right. So, you have to say that identifying the lungs, the feature is that we identify this based on this anterior border, which is this one. We should be able to identify the anterior border, which is easy to identify, any of the lung border has, which has sharp margins, prominent and looks like an elephant ear, and opposite to it we have the posterior one which is blunt. The anterior border which should be continuous, if it is, then no deficiency, no notch is there, then we call them as this is ideal one which is belongs to the right side, and left one should have a notch, we call them as cardiac notch deficiency. Now, this notch which I am talking or referring here on this anterior border of the left lung is not always throughout the length, it is not present. It is present within this particular anterior border of the left lungs, like extending between the 4th costal cartilage to 6th costal cartilage. That means, between this particular costal margin, 4th rib to 6th rib, we have a deficiency or curved part. Not entire anterior border is curved. Reason why this particular lower part of the anterior border is curved is that we have this left ventricle chamber which is taking much of spaces. So, that particular left ventricle chamber of the heart which is coming in front and taking up this particular anterior border which is extending between the 4th costal cartilage to the 6th costal cartilage on this particular sides of the sternum. Clear? So, not always or not that particular notch is extending from the 2nd rib to 6th rib. It is extending between the lower part of this particular anterior border between rib number 4 and rib number 6. Talar portion ta kintu amader notch ta thake. Then we have this thing. Now, at lower end where this particular costal cartilage or this particular rib at 6th rib region, the lower end of this particular cardiac notch which has a projections. That particular projections may be present or may not be present. That projections we call them as a lingula. It looks like a tongue. It looks like tongue is sticking out. So, that part left lung below this cardiac notch we have a projected part of this lung tissue, we call them as lingula. That particular lingula is not always present in all of the specimen because there are human variations are there. Some of the specimen may have a projected, looks like a projected part, it looks like lingula, some of them may not have it, right. So, again coming back to the site determinations of the lung, we go by identifying it border first, then we count the numbers 1, 2, 3. Ideally, we give this particular lungs during examination having this right lung having 3 borders and left lung having 3 lobes, and right lung having this left lung having this particular 2 lobes, right. But in some cases, if by mistake or sometimes some variations if they comes out, the examiner sometimes itself asks you about whether you understand this particular lobe differences with this particular notch differences or not. Alright. So, I am spending most time on this identifying feature about this, because this is the thing which helps us to go for further examination. If you cannot answer these basic questions, how this particular lungs is identified, right lung or left lung based on this particular anterior border, the next period or next question does not arise. Clear? So, this particular identification is must. Next, we have this particular lobes as we are saying here, upper lobe, middle lobe, right, and the lower lobe. Now, this particular lung is split into lobes by some kind of groups. We call them as fissures. So, there is a fissure which is constant in the right lobe and left lung as well. We call this particular fissure as oblique fissure, which is splitting the lung in upper lobe and lower lobe. So, this large oblique fissure which is splitting this particular lung which is into 2. So, upper lobe and lower lobe. So, both of this particular lung have got 2 fissures. This fissure is there which is cutting the lung obliquely. That means it is running like oblique. 3 lobes and 2 fissures. In the right lobe, in the right lung, we have 2 fissures and 3 lobes. One fissure which is cutting the lung obliquely, we call them as oblique fissure. That oblique fissure is also present in case of this left lung. So, which is a constant fissure for the both of the lungs. Additional fissure which the right side has a horizontal fissure. It will short and meets with this particular oblique fissure having a short distance coming from the anterior border cutting it. So, that particular lung which is present on the right side having an horizontal fissure makes this particular having lung split into 3 lobes, upper lobe, middle lobe and lower lobe. So, anatomical position. Now, this particular lung as you are seeing here, this particular fissure is oblique fissure. You should be able to identify the oblique fissure in both of the lung. An additional fissure which this particular lung has, this one is this one. This is horizontal fissure. So, these 2 fissures you have to put the fingers in it. This is oblique fissure and this one is horizontal fissure. So, these 2 fissures you should be able to identify in the specimen whenever it is given to it. Which one is oblique fissure? What is the function of oblique fissure? Which is splitting the lung into upper lobe and lower lobe, and horizontal fissure, it is splitting the upper lobe into upper lobe and middle lobe. So, we get the 3 fissures which is present, 2 fissures which is splitting the lung into 3 in the right side. Left side we have only 1 fissure which is obliquely cutting upper lobe and lower lobe. But in some of the cases we may see there is a presence of the variation, we call them as horizontal fissure may be there as well, and splitting this particular lung in the left side as well by 3 lobes. So, that is why I am saying because of the human variations may be there, we might get this particular left lung also having 3 lobes instead of 2. So, some variations may be there, or maybe this particular right lung may have only 1 fissure instead of this horizontal fissure is may be absent. So, both of the lung may be having 2 lobes, upper lobe and lower lobe. So, how we are going to identify this particular lung? By counting the numbers if you are just like getting 2 fissures. So, for that reason the constant feature this lung has is that we go by this constant notch which is this particular only the left lung anterior border has, which is cardiac notch, which is extending between rib 4 to 6 lower part, right. So, this anterior border is running like this on the right lung, left lung. So, this left lung anterior border reaching from this particular point is making a notch curve and then going like this. Okay. Now, once you have identified this particular specimen, you have to hold this particular specimen in normal anatomical position. So, anterior. So, anterior end should be facing anterior. So, this anterior end should be faced. Anterior end should be facing anteriorly. Posterior end by the what which will be grabbing like holding a neck. You can place this thumb folded like this, making a fist, and put this particular thumb under to it, assuming this is the diaphragm, which is making this domes of the diaphragm under to it. So, this side you have the domes of the diaphragm and anterior end will be anterior and will facing this particular examiner like this. So this anterior end should be facing the examiner, the posterior will be holding it. Now this is an anatomical position, anterior end, posterior end, inferior one and apex. This is how we are holding. If it belongs to the right side, you will be holding in right side, right arm facing it, holding in the gap. If it is the left side, holding in the left hand and pressing the other hand under to it. Clear? Now, once you have identified this, you have to identify the surface of this lung. The lung have got three surfaces, just like three fissures or two fissures it has three surfaces. Now, it has apex which is on our other side above. Now, this surface with the fingers placing like this surface you are don't move this anterior anatomical position. Anatomical position ta ghadda dhore rakhbi. Oi obosthay rekhei bad baki narration korte hobe. So don't move this particular anatomical position, or else during examination you will be mixed up. So hold it in anatomical position. Then with the other hand you will be just like demonstrating it. So this surface which has got rib margins, we call these margins as sternocostal margins. We call them as sternocostal margins. By the ribs you spread these fingers like this and you see that this is sternocostal margin. So all the ribs and in front sternum will be making those grooves into this particular margins of it. So this is one surface that this lung has. This is surface number 1. Surface number 2, this is the diaphragmatic surface which is lying under, also known as inferior surface, also known as base of the lung, which is because of the dome of the diaphragm lifting this up. So this surface with the face, what he is showing here is the diaphragmatic surface, also known as inferior surface, also known as base of the lung. Alright, so aka like this, right? Fine. And the third surface, this is the surface which is facing the mediastinum, where you see this hilum of the lung. So you see this particular surface again. Now break the fist, break the fist. This surface is mediastinal surface. How do you know the mediastinal surface? By the presence of the hilum of the lung. So this region of the lung we call them as hilum of the lung. So what is hilum? That's the doorway of the lung where the vascular structure or air tube gets in or comes out. What vascular structure? Pulmonary vein, pulmonary arteries, bronchial arteries, they get in or come out either for oxygenation or supplying nutrients to the lung. Air tube which breaks down into, from the trachea breaks down into bronchus, principal bronchus and so on, right? Segmental bronchus, lower bronchus, etc., etc. So that particular bronchus also gets in through it. So this region where this particular opening is there, that opening, the door, we call them as hilum of the lung. This hilum of the lung in a living or in a cadaveric state where it is not removed, we call them as root of the lung, where you can see the structure getting in and coming out, right? So the difference with this hilum of the lung with this root of the lung is that root where everything is anchored and its lung is not taken out in living condition or in cadaveric condition we are seeing here. Once you cut the lung out, the way you have it taken out, remove it, seeing this, then you can see this particular opening. Once you see the opening, then we call it as hilum of the lung or door of the lung. The door through which what gets in and comes out? The bronchovascular margin. That means bronchus vascular structures, right? In one word, what gets in, come out, bronchovascular. Then you split it. Bronchus means, what do you mean by it? Principal bronchus. Like after trachea, then the division we call them as principal bronchus. Then it has got divisions like upper lobe, yes, upper lower bronchus, middle lower bronchus, lower bronchus, like that, right? So this particular divisions is like that. Now after that, this particular region we have a pleural coat which hangs down like a thin pleural membrane like this, which he is holding, which he is holding like this. This particular thing we call them as pulmonary ligament. This is nothing but the remnant of that pleura. What pleura? We have two pleura there. We have this parietal pleura outside and we have the visceral pleura. So this visceral pleura hangs down just like a thin strip of tissue. We call them as pulmonary ligament. That particular pulmonary ligament is present on the lower end of the hilum, which is hanging down. It is nothing of any importance. It's not of great importance. It's a kind of like a space which is occupied by this particular pleura, which holds some lymphatics, which holds some blood vessels if it is present on it, right? Now, this particular mediastinal surface also puts some impressions of some underlying underlying some structures. What structures? The mediastinal structures are there in the mediastinum. They create a kind of impression on the mediastinal surface. We call them as impressions of mediastinal viscera or mediastinal organ into this mediastinal surface of the lung. Say for example, in this mediastinal surface over here we have an impression for the heart. We call them as cardiac impressions. So right lung and as well as left lung, we have this particular groove largely occupied by cardiac impressions. Now on the left lung you see that a deep groove lying on the back side of the hilum, which is making a deep groove. So that particular groove is created by this aorta which is going down. So aorta have got three parts. Climbing aorta we call them as ascending aorta. Then we have the arch. Then it is drops down, descending aorta. That descending thoracic aorta dropping down, making a curve impressions. Like, see that? This is. So this impression as you are seeing here is made by this descending thoracic aorta. Where you are going to see that in the back side of the hilum on the left side, which is very prominent, right? Similar to it, you see that in the right lung also have a curved impression. See, this is the hilum of the right lung. On the top of here, so we have another groove which is carving on top of it. That particular groove, that groove which you are seeing here on top of hilum on the right lung, that is created by arch of azygous veins, right? Then on here on the top side, azygous vein is draining in where? Superior vena cava. So superior vena cava will be on top here, finger like this, and this is azygous vein meeting in here, draining at the level of second costal cartilage. So here vertical will be SVC, and this azygous vein is arching and curving and draining into SVC. That particular region curvature we call them as arch of azygous vein, which you are seeing here, right? On posterior to it we have this tracheal impression. Anterior to it we have this tracheal impression. Behind the posterior side we have the vertebral impression. In front of that we have very faint esophageal impression. Esophagus do not make much impressions because it is a collapsible muscular structure compared to this particular trachea which has still tracheal rings, which is making some impressions there. This particular vascular structure makes a good impression because it's pulsatile. So once this particular blood flow is getting in, so it erodes and makes some kind of like a impressions into these particular soft lung tissues. That's why these impressions of the cardiac regions are visible. So there are a number of impressions which are present on it. Now coming to the hilum, there are some structure getting in, coming out. So first thing on the hilum, identifying the structure on the hilum is that easy to identify is presence of the cartilage. If you identify the presence of the cartilage, that will be the respiratory trees or bronchus which is going to get in. So this particular bronchus is easy to identify along the hilar structures. So what the structure going through the hilum, we call them as bronchovascular structure. Out of this bronchovascular, that means you have to identify the bronchus and the blood vessels. The bronchus is easily identified by the presence of the cartilage. You have to feel it and you can see it even, this cartilage which is present. So once you feel this particular cartilage on this bronchus, that helps us to make this particular bronchus to identify as an airway tube. Other than this, we are going to see some structure which is vascular structure. That means blood vessels. Some of them are pulmonary veins, some of them are pulmonary arteries. Once you see this particular lung in anatomical position, out of hilar structure, listen carefully. Out of this hilar structure, there are either pulmonary veins will be there or pulmonary arteries will be there. Now there is a kind of like orientation or kind of like a positions of the pulmonary veins and pulmonary arteries are there. Now the easy way to remember the basic thing about most anterior and most inferior of the hilar vascular structure will be pulmonary veins. Follow me? Again, most inferior and most anterior, most inferior and most anterior structures of the vascular structure that we have will be pulmonary veins and rest will be pulmonary artery. So, three structure we are going to identify. Bronchus, how we are going to identify them? Cartilage. So, you keep aside the bronchus by the presence of the cartilage. Then we are left with either vein or artery. either pulmonary vein or pulmonary artery will be there. How to identify or distinguish between which one is pulmonary vein and pulmonary artery? In both of the hilar structures, most anterior and most inferior will be pulmonary veins and rest will be arteries, bronchial arteries, whatever, right? Now, once you are given this particular hilum, how you are going to find the anterior and inferior? By the same anatomical position. Don't change the anatomical position. Hold it in normal anatomical position, right? Anterior, posterior, above and below. Then we identify this vascular structure most anterior and most inferior. So identify them as pulmonary veins and rest will be pulmonary arteries and trachea if it is present, cartilage. If it is present, that will be the bronchus. Easy way to identify. Rest of the things you have to read the books and follow these particular impressions. This particular impression should be ideally present. The right lung and left lung should have this much of impressions that it has or should ideally have. Out of this, you should be able to identify the cardiac impressions that it has, impression for arch of aorta and impressions of this azygous vein and which is draining on the vein which is the superior vena cava. So, these basic impressions that it should be making on should be ideally able to identify. Rest of them may be very present, may be very obscure. You never know which particular impressions will be taking up. So, ideally it should have an impression like this. It should be identically identified like this. Otherwise, the hilar structure you must identify as pulmonary artery, pulmonary vein and this bronchial structure. Out of these three, the must identifying feature is that you should be able to identify this bronchus. How to identify the bronchus is that? By cartilage. So, identify at least this bronchus by these cartilages. Then, if you cannot identify which is anterior, which is pulmonary vein and pulmonary artery, just don't let it be. Just let go. If you remember this particular formula, most anterior and most inferior will be pulmonary vein. If you can remember that long during examination, it is even good. If you cannot, just let go. Just identify this pulmonary, identify these cartilages. By these cartilages is which is the bronchus, which can be identifiable. All right. Now, to summarize the thing, whatever we have identified, the lung, you should be identifying this particular lung as a tissue. This is a lung tissue. Once you identify this is lung tissue, we have to identify we have two lungs, right lung and left lung. Right lung and left lung we have to identify based on this particular anterior border. So, once you getting this apex, you have to identify this is apex, then base you have to identify which one is base. Then you have to identify anterior border, then you have to identify posterior border. Once you identify anterior border, posterior border, then go by inferior border. Then so you identify this anterior border, see that if it is continuous or discontinuous. If you are having a notch, then it goes in favor of the cardiac notch which is present on the left lung. Then if it is left lung, it should have two lobes, upper lobe, lower lobe. If it is having two lobes, it should have one fissure. What fissure? Oblique fissure. Oblique fissure splitting this particular lung in upper lobe, lower lobe. Done. Then if do not have any notch in the anterior border, then it goes in favor of right lung. Right lung, if it is there, go by the counting this particular fissures. How many fissures you should have? It should have two fissures. One fissure which is oblique and then the next one which is horizontal. This particular having two fissures splits this anterior right lung into three lobes, upper lobe, middle lobe and anterior lobe, and not having notch within this anterior border goes in favor of all the way to the right lung. Then we identify this particular surfaces. How many surfaces we have? Three of them. We have this sternocostal surface which is present on having this particular costae or groove margins are there. Then we have this diaphragmatic surface also known as inferior surface, also known as base of the lung. Then we have this particular other surface, mediastinal surface. How to identify the mediastinal surface? We have the hilum. What is hilum? We know that definition of hilum and what structure goes in and come out, which is bronchovascular structure, bronchus and vascular structure. Out of the vascular structure, there are two of them, pulmonary vein artery or pulmonary vessels or bronchial vessels. Then bronchial vessels which are smaller, we do not appreciate that particular bronchial vessels very well, but the pulmonary vein and artery need to be identified if possible. Easy way to differentiate between pulmonary vein and pulmonary artery, hold it in normal anatomical position. Once you have this normal anatomical position, identify most anterior and most inferior end of the hilum structure. The blood vessel which is most anterior and most inferior should be pulmonary veins. Pulmonary veins which is present in here and we identify this particular pulmonary veins accordingly, and then whatever the left will be pulmonary arteries, right. So this is the way to identify this. Now anatomically, whenever you are holding it, try to hold it in right hand. If it is right lung, left one, left one. Identifying anterior border should be facing this external, and the base which will be grabbing that in your head, and you can place this particular thumb or fisted thumb, like a fisted hand like this under to it, mimicking this diaphragm like this, right. So everybody should be holding it in anatomical position, identifying and putting the logic on how this is anterior lobe, why this is right lung, why this is left lung. This particular mediastinal surface should have these particular impressions. Two impressions is must to identify for this undergraduate examination. One is cardiac impression. Both lung have got cardiac impression on the mediastinal surface, right lung and left lung. And left lung additionally have a impression by the great vessel, which is descending thoracic aorta with the arch as well, and the right one having a vascular impression which is made by this arch of azygous vein, which is draining into which vein? As superior vena cava. These basic information you should carry on. Anything beyond that, you can just like excel with good marks. This is good enough to pass in examination, right? Practice it. Dekhe nao. We have this, compare with it. Esophagus will be posteriorly placed, right? Esophagus, which mediastinal structure? Posterior mediastinal. So it will be behind this hilum of the lung, right? পিছনের দিকে থাকবে, in front of the vertebra থাকবে তার মানে, তাই তো? vertebra পিছনে থাকে esophagus নাকি? So whenever you are placing this particular thing, remember this structure which is present in anterior, middle and posterior mediastinum. So posterior mediastinal structure will be on the back side of the posterior border. So vertebral impressions থাকবে এখানে, তো vertebra আগে তার মানে esophagus এর impression থাকতে হবে, তার আগে তার সেরকম ভাবে থাকতে হবে, ট্রেকিয়া তার আগে থাকবে এরকম ভাবে, ট্রেকিয়াটা সামনের দিকে আছে, ভয়েস বক্স তারপরেই ট্রেকিয়া। তো so orient yourself by the logic of how the structures are placed and how this impressions is going to make a mark, and corroborate with your findings which is present in here. With this ideally should be there. If it is not there, remember two of these particular impressions I would go for. One is for the cardiac impressions and other is for the arch of aorta and azygous vein. These two at least you remember. And if you remember the azygous vein, next question comes here is that where this azygous vein drains empties to, which is the superior vena cava, which is easy one to just like come out, right? Now everybody should be holding it in anatomical position, and check you the pen whether you are holding in normal anatomical positions. Other thing I forgot, so before I forget anything, you have to identify this apex of the lung. So once you have given this particular lung, you have to identify the apex. Now apex is defined by this particular region by assuming that that particular tissue of the lung which is above this rib 1. Alright, listen, how to identify the apex of the lung. So the apex of the lung is that particular lung tissue which is above or beyond this rib 1. So this rib 1 we have the tissue of the lung which is above this rib 1, which will be called as the apex of the lung. So apex of the lung is placed like this, assuming this particular rib 1 like this. So this particular tissue, it is apex of the lung. So if this examiner asks you to demonstrate the apex of the lung, don't put a point like this is apex of the lung, that it will be a good courtesy. If you just like show it like this is the rib 1 and this tissue which is above this particular rib 1 is apex of the lung. So this particular apex of the lung is lying above the rib cage. So what I am saying here, the apex of the lung is above rib cage. So this apex of the lung is present in here. On top of clavicle it is popping up here. Now if I get a needle, I can collapse the lung with a needle. By pressing it here, it can be drained out all the air in here by doing a procedure by piercing this clavicle on top of it. So this particular part of the lung is accessible to exterior. So it is not guarded by this particular rib cage. It is lying above this rib cage, above here. So rib 1 is there, and beyond that, that pops up is the apex of the lung, which is lying on top of the medial end of the clavicle here, over here. Right? So this part is covered by a pleura. We call them a cervical pleura. Cervical pleura is reinforced by a aponeurosis. We call them a Simpson's fascia. Simpson's fascia is an aponeurosis or kind of like a super thing or super membrane which is formed by a muscular element which is known as scalene group of muscle. So this scalene anterior has a sleeve which is coming down from the neck, which is the neck. We have a thick fascia. In the neck we have a thick fascia, we call them as investing layer. So that investing layer, thick fascia, blends with this particular scalene anterior muscle and creates a membrane on top of it. We call them as suprapleural membrane, also known as Simpson's fascia. So Simpson's fascia can be covering this, can be penetrable by the sharp objects. So this apex of the lung is very vulnerable for rupture. We call them as pneumothorax. Air can get in from outside and can squeeze the lung. Which lung? Upper lobe of the lung can be squeezed very easily. So if you have a trauma on top of the medial end of the clavicle. Alright, so apex of the lung is must know, base of the lung is must know, borders you must know, lobes and fissures you must know, and medial side hilum and hilar structure, bronchus is a must know. If you can identify this particular like other vascular structure, pulmonary vein artery, most anterior, most inferior will be pulmonary veins, rest is something I don't know, right? That's it. কালো গুলো হচ্ছে bronchial tissues ও blood vessels গুলো যাচ্ছে ওর মধ্যে, bronchial vessels গুলো যাচ্ছে। তাহলে most anterior, most inferior কোনটা হবে? Most inferior will be good. ব্যাস রেস্ট আমরা রেস্ট আর দরকার নেই। বালবারি গুলো আর্টারি হবে বাই ডিফল্ট, ঠিক আছে? ওগুলো হ্যাঁ most anterior, most inferior, ওই তো ঠিক আছে। এটা কার্টিলেজ আছে।